So we see this crisis growing. And for weeks and weeks, we've been talking about getting ready for this, and we have to get ready for even more. And it's not just the incredible toll this is taking our healthcare system. As you've heard in recent days, the number of cases is growing, is also putting a huge burden on our emergency system. I can't thank enough everyone at EMS. They're doing amazing work under the toughest circumstances. Our EMTs, our paramedics, all the officers, everyone who is doing such important work at EMS. We thank you and we feel for you, because I know that the number of calls to 911 have been skyrocketing. It's putting a huge, huge demand on EMS. Let's be clear, and Commissioner Nigro will be available to speak to this later on in the question and answer. This is unprecedented. We've never seen our EMS system get this many calls, ever. But what Commissioner Nigro is doing with his team and our Deputy Mayor for Operations, Laura Anglin, is we're making a series of very fast, intense moves to ensure that more personnel will be available for EMS. We're going to shift personnel onto the work of EMS. We're going to come up with more ambulance shifts, additional vehicles, whatever it takes to keep serving New Yorkers who are in emergencies. We're also going to make sure that folks who don't have a pressing emergency, because we all know for years and years folks have called 911, and most of those are true emergencies and some of them are not. Anyone who's calling and needs something else, doesn't need an ambulance but needs a different kind of help, we're going to find a way to get that to them too, so ambulances are never going to a place that they don't need to be. But what we have to do first and foremost is put on more personnel, more ambulances, more shifts, and we are doing that immediately so we can serve the true emergencies, and there's a lot of them, to make sure that New Yorkers get the help they need. Obviously, there's been a lot of attention on the situation in our hospitals in general, and in particular at Elmhurst Hospital in Queens. I'm just going to give you a few quick points. Dr. Mitch Katz here with me will talk about Elmhurst and health and hospitals more specifically. But look, the bottom line is the incredibly valiant team at Elmhurst has gone through so much in the last few weeks. It's an extraordinarily effective hospital, real professionals who have found a way to keep saving so many lives while dealing with such pain at the same time and real loss. And you can imagine how hard it is for people whose whole life is saving lives to see that sometimes there is no way to save a life. But they have been doing amazing, amazing work to save so many others. We've been sending constant reinforcements, so 169 clinicians have been sent in recent days to Elmhurst. That means physicians, registered nurses, nurse practitioners, and physician assistants. 100 nurses this weekend alone. In addition, within the hospital, clinicians have been moved from outpatient activities to ICU activities. Staff from the central office of health and hospitals are moving in, taking on roles in terms of ICU and emergency department. We're going to keep moving personnel and getting more personnel constantly to help Elmhurst and every other hospital that needs it. This is going to be an extraordinarily tough next few weeks, but we will keep sending more and more reinforcements. And again, we have to get the good people there doing such tough work. We have to get them a break. We have to spell them. And this is why I want to see medical personnel come in, not just from New York City, but from all over the country, including those military medical personnel, because we have to give these extraordinary heroes a break at places like Elmhurst. Also, ventilators, we have added 55 ventilators to Elmhurst over the past 2 weeks, and we will keep adding whatever number of ventilators they need. So this will be a nonstop effort. Across health and hospitals, the whole system, the 11 hospitals, 500 contract nurses have been added already, 500 more coming this week. So we are just going to constantly reinforce. Now I want to turn to supplies and the distribution of supplies, and I've already said our first milestone is this coming Sunday, April 5th. We must shore up to get ahead of the challenges we will start to face that following week. So this is a race against time. We have gotten some real help, as I said. The ventilators that came in from the federal government, some are coming in from other sources. That's helpful, incredibly helpful. We need it all, and we are thankful for it all. Yesterday, we sent 1,400 ventilators out to our hospitals. to all types of hospitals. That is a huge step forward, but that number we need overall is still 15,000. So we've made a big dent between different sources to get toward that 15,000. We have a long, long way to go. We still need to see the federal government do a lot more and more quickly. We need the Defense Production Act utilized to the maximum. We need to see a distribution system that's fast and intense. And again, I think the military must be involved. And again, my specific request to the federal government is 400 more ventilators by April 1st to get us ready for later in the week when we expect the upturn to really intensify, and we need those ventilators to be in place and ready. In terms of personal protective equipment, PPEs, a very moving moment yesterday when the United Nations provided 250,000, a 250,000 surgical masks to the people in New York City, to our healthcare workers, our first responders. The United Nations, we are their home, and they did something very good for their hometown with 250,000 surgical masks, and we've asked them any and all help they can provide going forward. We will need it, and those masks are getting out to our hospitals right away. Dr. Katz will speak to the overall situation, but my message to all the doctors, the nurses, the hospital staff, starting with all our colleagues at health and hospitals, our public hospitals, but to all those out there in the voluntary hospitals, the big hospital systems, the independent hospitals, we are all in this together. We're going to go and work to get you every conceivable supply you need and get it to you quick. We have to protect our healthcare workers, and that's what we're working on every single day. And we can only, all of us who are not healthcare workers, can only imagine what you all are going through. We have to be there for you and get you all the help, including the additional personnel, immediately. That's our job. In terms of health capacity, we're all really moved by the fact that the USNS Comfort is arriving tomorrow. I'm really looking forward to greeting the men and women, the medical professionals, the sailors, everyone who's making this possible. I want to thank our colleagues in government at the Economic Development Corporation who played a crucial role for the Comfort to dock and be able to add immense hospital capacity for the city instantly upon docking. Well, they had to be able to dock, and they weren't going to be able to dock unless the dock was dredged to allow for a ship of this size. The operation was supposed to take 2 weeks. The folks at EDC, working with the Army Corps of Engineers and the State Department of Environmental Conservation, they got the job done in 8 days. And so the Comfort will be arriving tomorrow and will right away be making a difference in this city. And we are so, so grateful to the Navy, to the military, that this new help will be arriving in our city. Also very important in Central Park, and we're going to be using every place we need to use to help people. Mount Sinai Hospital, working with the relief organization named Samaritan's Purse, is creating a 68-bed field hospital. So this is the kind of thing you will see now as this crisis develops and deepens. A partnership with Central Park Conservancy, our Parks Department, the Mayor's Office, we all work together to get this done with Mount Sinai and Samaritan's Purse. Going up now in the East Meadow, should be operational by Tuesday.